integration of all the different techniques that we promote with Gestalt education, and it's not all that uncommon that we would have joint plated spine, maybe done manipulation, maybe if it was a disc case we would have done some centralization, and then it would be a perfect time to start working through a lot of the things that we did this weekend. So we can pretend, like I said, that we've already perhaps manipulated him, and so now, and let's just assume he's centralized, so now I could go right in with some of the things that we talked about from the sideline position, rib cage down, coaching intra-abdominal pressure. You're never going to work on anyone who's got a spinal complaint that's got normal normal girdle function. So we're always working with the muscles around the pelvic girdle and the shoulder girdle, always, but especially when we're dealing with a low back problem or an upper thoracic problem. So this would be like a great cherry on the top of that treatment, if you will. So don't let me move your pelvis forward. Don't let me move you forward. So now, even if we've been dealing with the disc derangement in his low back, we're now able to activate all the muscles around the hip and intra-abdominal pressure. Obviously the spine is neutral, so we're in a really safe position here. We can do the same thing here. We could have disc derangement at C5, C6. It's already been centralized through a McKenzie protocol, and now we're starting to work on the activation of the muscles around that area, kind of the Y of the derangement. So the point I'm trying to make is how we mix and match all our techniques within one treatment session a lot of times. Like I think a lot of times we think that we are initially going to classify the patient and we're only going to do that modality with the patient, and I don't think that's right. So I think it's always about mixing and matching and interaction our different modalities, and when we do that we have better success.